Hello, everyone. Welcome to this panel discussion on sharing novel efforts to increase access to mental health and substance use disorder services and treatment. I'd like to begin by introducing the moderator for this discussion, Bree Ryman, Assistant Vice President, Practice Improvement and Consulting for the National Council for Mental Wellbeing. Bree, it's a pleasure to have you with us today. I'd now like to turn it over to you to get things started. Thank you.
Well, thank you so much, and thank you all for joining us today on this important topic as we really share light on novel efforts to increase access to mental health and substance use disorder services and treatment. I find this topic, as I'm sure you will, a very timely topic as we are facing a workforce crisis, a national workforce crisis. As the demand for services for mental health and substance use services is growing, we're seeing a workforce shortage that is impacting virtually every community across the country. And this is something that we have to address, and we have to address quickly because these services are so needed. And I know that we will continue to see some efforts like the ones that we'll share today around innovations that will help to support the continued growth of our workforce. So with that, I'd really like to invite and introduce our speakers today. We have two very esteemed speakers who can really speak to this topic and share some really innovative approaches that they are seeing within their work. We have Dr. Nick Dewan, Vice President of Behavioral Health for GuideWell, and Helena Plater-Zyberg, the CEO and co-founder for Supportive, who are going to be sharing with us today. I think I'd like to open it up today with just a conversation around, how your work is really impacting the workforce shortage. So I'd love to have each of you tell us a little bit more about your role and how you are helping to improve access to mental health and substance services. So let's start with you, Helena, if that's okay.
Sure, of course. I would love to share what we're doing with Supportive. So we are an organization that is 3 years old. And of course, that means that we were established prior to the pandemic. And when we came to market as a on-demand peer-to-peer support network, our thought was around how do we get more people who wouldn't normally engage with the traditional behavioral health system excited about sharing, their mental and emotional health struggles in a format that can be productive and drive outcomes. Now that you point out the massive shortage that we have, peer support is really an entry point that can handle low acuity mental health needs and allow for more efficient triaging and navigation, if you will, of people with higher acuity needs into those appropriate services, but still kind of handle the broad swath of population-wide needs.
Thank you, Hella. We look forward to hearing more about that and how you're working to really enhance peer support services through your work. And how about Dr. Dewan? Could you share a little bit about how you're really approaching the workforce shortage?
Sure. Hi, Nick Dewan here. I'm the Vice President for GuideWell, which is the parent company of Florida Blue, which is the local Blue Cross Blue Shield company here in Florida. And we've increased our provider network by over 1,000 clinicians this year. And we have trained all our medical care managers on behavioral health. We've trained all our, what we would call our local centers on behavioral health to actually do interventions. And we've actually supported organizations to increase peer-based services. So the entire continuum from specialty psychiatrists to therapists to peer-based support, we are supporting initiatives to enhance what I would call the access through any means possible, face-to-face or virtual. And I'm going to enjoy getting into the specifics as we have this conversation today.
Great. So it sounds like there's a lot of synergy between maybe your work, Dr. Dewan, and Helena, your work, specifically around peer services. So that's excellent to hear. Helena, I wonder if you might dive a little deeper around some innovative approaches and work that you're doing with Supportive.
Sure. we really wanted to take the best of what is available traditionally face-to-face, things like the concept of Alcoholics Anonymous or grief support groups, where there's, live synchronous human interaction among people with shared lived experience in a facilitated and moderated forum, and really make that available to everyone across the entire spectrum of mental and emotional health needs in real time on demand. So that's what we set out to build. And technologically, we had a couple of underpinnings that make this possible. One, we really thought, the concept of having appointment-based help is something that we can do away with, because we live in a world where you're having an emotional need right now and you want help right now and you want it live. So we created technology that allows people to express themselves in just kind of free text, what is going on in their lives. And we have natural language processing, which is sort of a advanced type of artificial intelligence that can read and understand that language and match people in just a few seconds into small groups of other concurrent users who are going through that same struggle. So you've instantly created that live human connection, up to 6 people at a time. And we provide the professionally trained facilitators and moderators for these groups. So that way we're ensuring that these live groups are built around a topic, actually have an arc, a conversational arc. So we're taking people from that stage of kind of venting about their issue into the more productive stages of, here are some coping skills we can introduce. Here's a way to facilitate collaborative problem solving. Here are techniques that might be helpful in the healing process. And then on top of that, we have another technology layer that is reading and understanding these forums, which are all happening via anonymous chat. And we're actually matching people's expressed needs in real time to resources that are going to help them. So here is a workbook exercise, here is an article, here is a video that is acutely relevant to what you're describing your expressed needs are in real time, and we're bringing that into the conversation. So because of the power of the technology we've built in this platform, everyone is walking away with kind of tangible, feelings of betterment, tangible next steps. And I'll get a little bit more into it later, but really it's kind of bleeding edge stuff that we're doing.
Sounds like really timely innovation with where we're at with the workforce shortage, and really offering unique solutions to the workforce shortage. I loved what you said about artificial intelligence, and I look forward to hearing more about that. And also if there are any potential barriers related to the technology and how you tackle that. But first, let's go to Dr. Duan. Can you similarly share a little bit about innovations or really sort of outside of the box strategies to addressing treatment and access to treatment today?
Sure. Let's start with, we believe that we should increase access to mental health as much as possible. And so for us, it means having all channels available, whether it's calling a 1-800 number, whether it's calling a consumer support center, whether you're on the phone with, say, a care manager, whether you're on the phone with a primary care office. We've created what I would call layers of access capability. So there's a digital, some people just want to use their phone or their device and they want to work through the portal and they ask a few questions and it immediately prompts up, hey, we can get you connected to somebody so you can get an immediate on-scheduled. It's not as quick as what you just said about on demand, but hey, within 24 to 72 hours, we'll connect you to somebody and we'll make the appointment and we'll get in there. So there's a immediate digital connection. That's for people that want to do the digital connection. For other people, it says, well, I don't want to talk to anybody right now, but I want to be able to text somebody and can they reach out to me in a couple of days? We have that availability. So there's sort of that, I want to request somebody to give me a ring because I just want to talk through stuff. Then we have our primary care colleagues that say, I'm not really sure who to send. I've got a patient with, let's say severe OCD or severe PTSD or severe alcohol use. I don't really know. We have auto connectors then to those highly specialized, because it's not only what I would call low intensity, moderate intensity, sometimes it's severe and extreme intensity. So we're trying to serve every segment of severity. We're trying to have channels that serve everybody's needs. I don't think we've figured everything out, but at least we're on the journey to say, how are people experiencing, say, digital life right now? How are people experiencing day-to-day, regular face-to-face life? What are their normal, what I would call search journeys, find care journeys, get care journeys, and what I would say evaluate care journeys? And then we design solutions to address either gaps or barriers. And so I think we've done both what I'd say the human intervention side, which I think is always important, the digital intervention side. And I think how we've approached, we do have some AI technologies going on, but we've also done what I would call the merging of behavioral health data with physical health data. So everything we look at now, we look at through a holistic lens. And when you share that kind of information with whether it's your behavioral health colleagues or medical colleagues, their eyes light up and said, we never knew that. We never knew that this combination had this sort of impact. And so the innovations are, I think of it in three different ways. I think of the innovations in the analytics innovations, identifying the needs. I think of the innovations in multi-channel delivery of solutions. And then I think of the innovations in how do you get a system of care to embrace value-based behavioral health? How do we create incentives that say, this is important enough for me to pay attention to? So we've tried to do innovations in all those three areas: analytics, solutions, and incentives and quality measures. So that's how, a large healthcare solutions company that has, multi-state involvement addresses the big ecosystem of care. And that's what we're innovating and disrupting the ecosystem of care. Whereas, innovators like Helana are innovating the site and the point of care. And we have some point of care stuff we're doing, and I can talk about that later too.
Thank you, Dr. Dewan. And I think this disruption is exactly what is needed right now in today's healthcare environment. And I'm curious if you both would share a little bit about how these innovations that you talked about are really helping to engage a workforce that we're seeing is facing, trauma in the workplace and considering leaving the field entirely to work in other areas. We launched at the National Council a workforce survey recently to all of our members who are mental health and substance use organizations, and learned that some of our members are losing their staff to places like McDonald's, Dunkin' Donuts, because the pay is, quite frankly, higher than what they're able to provide. How are these digital innovations helping to re-engage a workforce who is feeling quite depleted?
I mean, I'm happy to speak to that because one of Supportive's earliest and largest customers is actually Walmart. So talk about a workforce that has been on the front lines and kind of inundated with the physical and emotional brunt of the pandemic. I think what's interesting about that case study really is that Walmart has a host of benefits for its associates, including an EAP, including other video behavioral health offerings, and actually text-based behavioral health offerings. And what they were finding is that was, not reaching the full extent of their population. A lot of the workforce is nervous for obvious reasons to engage with, offerings from their employer and from their health plans, as we all know. So Supportive really kind of embellishes the offerings that they have in the sense that this is now, again, that immediate place that people can turn to for that first case of stepped care. So we're seeing utilization among that workforce that is over 6x what some of their other behavioral health providers are. Because when we couch something as this is this is peers. This is just a chat. This is not, there's no assessment forms that you have to fill out. There's no appointments that you have to make. There's no hurdles. Just come on in the middle of the night. I mean, our, peak usage hours are actually 9 p.m. to 3 a.m. across the United States. Weekends, so Saturday and Sunday. Sunday nights are our highest traffic on the platform. So this is something that has shown the workforce there that there is emotional support available to them whenever they need it. On top of that, I'd like to go in a little bit deeper and talk about sort of what Dr. Duan mentioned, that there's this ecosystem of services available. And navigation is a key part of it. And I do fully agree that, the blending of physical and mental health is critical. So what we actually have done in our peer support chats in this case is that we have processed and tagged all of the other benefits that are available to them in the entire Walmart Health benefit ecosystem. And as people speak freely about what they need, we're not just reading keywords and what they're saying, we're actually using natural language understanding, contextual understanding of these expressed needs. And we're able to say, hey, you're talking about this struggle that you're having quitting smoking. Did you know that you have this program available to you? Or you're really afraid that, this pain that you're experiencing is going to lead to a surgical intervention. Did you know that there's this center of excellence that you can try? And so our ability to understand vernacular and how humans communicate with each other is enabling us through technology to also be that navigational point, at a cost that's maybe 1/20th the cost of other navigational platforms.
Elena, it's interesting, you brought up the work with Walmart. Our partner, New Directions Behavioral Health, is the EAP for, in Arkansas for Walmart. And so I love this idea of this layered. You got to have there's not enough clinicians in the United States to deliver services, and a facilitated workforce peer support with what I would call curated intelligence and the navigation piece, accessing. To me, that is sort of a very comforting thing for some, you finally have the courage to go out there and say, let me, share what I'm hurting for, and to get immediate, instantaneous, that's a great thing to offer people who are suffering, who have finally had the courage to say, I need to get help. Now, our efforts are the more traditional, where, you fill out, where am I, in terms of my hurtfulness. And we do that because we have to measure. Did we make a difference? Did people come in with, say, a high severity? And did they leave with in remission or low? So it's a more clinical sort of pre-post kind of thing that we're compelled to do. And I think the partnership of handing off, of triage, triage support, it's sort of like you're like the EMS for behavioral health. You just call up and you get this, and then you say, okay, we've done the triage, we've done sort of the early stabilization, but looks like you could really use XYZ, and we really want that. We want people to use their behavioral health access. And if they get support and they get some mitigation of the crisis, that's wonderful. That for us, that's wonderful. And so I know I'm going to be speaking to our partner, New Directions, after we're done to see, hey, how's that Walmart activity going, and how's that partnership going? Because, we have EAPs around the country. We work with some of the largest corporations in the United States. And so I think you're working with some of the same ones we work with. Yeah. So I'm going to find out exactly how that partnership is going. So
sounds good.
Well, and we do have a question coming up, and I want to explore partnerships a bit. But I'd first like to pivot towards, health equity. You both talked a little bit about a customized approach to on-demand services and building this ecosystem. And I really am curious about how these innovations are really helping to reach different populations, marginalized populations, and the unique considerations for really just health equity and creating that space for people to engage with your experiences. Would you mind sharing a little bit about that?
Sure. Dr. Kwan, would you like to go first this time?
Well, I tell you what, let me give you the broad context, how we're approaching equity as a company, and then talk about specific, because I think this is really important. I mean, first of all, I think the fact that the American Psychiatric Association apologized for the years and years of systemic racism was very important. I think that was a humbling event. And I think we as a society have to embrace the fact that there have been centuries of what I would call injustice, and that we're not going to cure this in 1 year. This is going to have to be a lifelong generational commitment. And so that's how we are approaching it. And we approach it first of all, we approach it internally to say, this is so important. We changed our values of our corporation. We have inclusion as our value. We added inclusion to respect, imagination, courage. We added that. And we created an internal capability where, although we might have an extraordinarily diverse workforce, women leaders, Black leaders, throughout this, we said we have to do a better job of growing leaders. So we're going to do that. We partnered with historically Black colleges, and we're training the clinical leaders of tomorrow. We're partnering with large state-based educational programs to say, we want to be part of the educational energy that sort of changes the culture of clinical thinking. So we're embarking on that. We are doing our best to make sure that we ask those questions about, what's your preference? Now, we can't suddenly increase the workforce from 2% to 12% overnight. We can't do that in 1 year, 2 years. So we're making those investments in those communities. We're making investments in training programs. We're making investments in leadership development. And we're making investments in educating the workforce to think about these issues. And we've made a commitment to look at data differently, because right now data is missing. And data on this issue is missing. And unless we fix the data problem, we won't be able to address the equity problem. And so that's how we, once again, transforming the ecosystem of care is what we have to do. Improving the health of people and communities we serve is what we have to do. And we have made investments in resilience and community investments. We've made investments in training programs. And so for us, this is a core gut-based initiative for us at Guidewell and Florida Blue. And we're doing this with all our partners. We've made a commitment. We're asking all our partners, what's your investment in this? How are you approaching this? Will you join us in moving this issue forward forever? So when a company changes their value system, it's not this year, it's a forever commitment. And I would like every company to embrace that value. So hey, thanks for letting me go first. Appreciate a lot.
I really appreciate you sharing, Dr. Dewan, and also just that accountability piece in terms of the charge for all organizations to address equity in a different way. And I know at the National Council, we similarly have really changed our strategic goals to really highlight diversity, equity, and inclusion as a core function of all of the work that we do. So I think it is a responsibility for all of us to have these conversations, to sort of have this shared learning around equity. So I appreciate what you shared there. And Helen, I'd love to hear about you and your efforts as well.
Oh, thank you. I mean, I applaud the efforts that you have towards the system view, because that's, obviously much needed, and bravo. And like you pointed out earlier, my view is much more, today and point solution oriented. So, I mean, I'll mention that, my co-founder is a person of color, of supportive. And so this was really out of the get-go, from the gate, an interest point of ours, and saying, how do we make something that is the opposite of the alienating system that other people have encountered for so long. And if you look where a lot of the care has migrated in mental health care among sort of these non-included communities, it has been community-based, and peer support was sort of the mainstay of one of the channels of a care that was accepted and embraced. And so we really took that and thought, okay, how do we not lose what's so powerful in this? And along the way in building a solution, we were asked, many times, oh, are you going to make it video-based? Are you going to make it voice-based? And we eschewed both of those options because and actually, I'll admit some researchers from Johns Hopkins were really valuable in this, because human judgment is instinctive. And as soon as you see someone or you hear their voice and all of the socioeconomic, legacies that implies, you're making judgments about whether someone is truly your peer. You may both be going through the same exact thing, but feel, well, that person's a man and I'm a woman, or that person's a teenager and I'm an adult, but our mothers both just passed away. So by having a forum like what we've built, which is anonymous and chat-based, chat is really the great equalizer. You can have a PhD or you can have not yet your high school diploma, and you're kind of chatting like idiots the same way. And so we've taken away all of those traditional, gender, racial, socioeconomic barriers and really even the playing field. And as a result, we are seeing that we have a format that is engaging across the diversity spectrum, because people really feel like the connections that are being made are about the shared lived experience that they're there to discuss, and not any other of these trappings that, usually get in our way.
May I add, I just want to add one more philosophical kind of approach of how, I kind of look at this. COVID has taught us that when you have an invisible potential threat, that trauma weighs on you. It weighs on you and weighs on you. But here we are, we've had a visible threat. A certain community has experienced a visible, palpable, ongoing threat for decades. And that everybody should know how traumatic that is. And anything we can do to offer access, support, change the equation is important. So your comments about the chat equalizes everyone. Okay, chat equalizes. And so I think that's the beauty of that. And I'm so pleased that you're able to merge those technologies with the chat function.
And how do we find other equalizers similar to the chat functions in the healthcare sort of ecosystem? So I'm very curious to explore that and unpack that a bit as we sort of move on with our questions. So I'd like to explore a little bit. Partnerships has come up a bit through this conversation, but what partnering organizations are you working with in building relationships to address the workforce challenges?
Oh, we're just in Florida. We're in 67 counties, and in each county we partner with individuals and organizations and nonprofits. And so we are a local, many people see us as the local neighborhood partner. And that's really what we want to be. We want to be that local entity that says, how can we address things like food shortage? How can we address things like early education? How can we address things like capital investment and entrepreneurship? All those social determinants of health. You just can't navigate and care manage your way out of that. You have to make tangible, bold solutions and interventions that are measurable. And so that's how we look at addressing this in every facet of society, in every community, in every county. And we select particular neighborhoods and zip codes that we say we're making, whether it's $1 million investment, $2 million investment, $4 million investment, we make those investments in those communities, in those neighborhoods to say, there's no other way to move the needle. You just can't just do sort of have a care manager. You can do that, but you got to add these other facets to it. You have to add these other facets. And then when we have the point of care solutions, we have clinicians embedded, we do outreach, mobile crisis or mobile outreach. That's sort of what I call the on the ground troops that we have. Or when we fund organizations that say we have a peer-based initiative and we go to ERs and help people who have overdosed, we'll fund that through those provider organizations. So anything we can do to enhance point of care or the general ecosystem, we invest in that area throughout the state.
Thank you, Dr. Dewan. I love what you say. You can't just care manage your way out of that. And you have to really think broader to other bold solutions. So I think you're
No, but care management, I'm not gonna say care management is bad. I think care management is awesome. I think it's necessary. I think it is soulful work, but you have to have, you can think of care management as wraparound, but then you have to have another wraparound that wraparound. And that's what we're trying to do.
Great. Thank you. And Helena, what partnerships are you engaging with through your work with Supportive?
Sure. I mean, to date, we're not just working with large employers. We've also forged partnerships with both state and national health plans and, their EAP offerings. Hospital systems now, because you talk about workforce needs, we've started being a benefit available to healthcare workers, and we're bridging into university because obviously the campus mental health needs are extraordinary as well. I think that in terms of kind of the flip side of what Dr. Dewan has said, I mean, we don't consider ourselves like the solution for anybody. We're designed to be a piece of the puzzle and to make the rest of the system operate more efficiently and smoothly. So, with partnerships in mind, we actually didn't create Supportive to be a standalone entity. We actually exist as a little widget that can populate into other people's platforms and sites and other people's apps. And actually, so the members of these organizations don't even have to leave their existing environment to engage with Supportive and then return exactly to where they are. So we fully came to market with partnerships in mind.
Right, and I love that partnership with the universities as well, because one of the things we know is sort of one of many solutions to help address the workforce shortage is building that pipeline to really bring people into our field. And I think just by nature of Supportive's work, you're able to do that by sort of shedding light on what the field is about and the unique sort of opportunities with digital innovations, real-time, outside of the box sort of solutions. So thank you for sharing that, Helena. And I think, I have one sort of final closing question that I think will help to bring this home. What's ahead for the field, and what advice would you provide to stakeholders for thinking of solutions, and where should they be thinking about in terms of, their solutions and sort of learning from your experiences? Dr. Dewan, would you like to start?
Sure. So I started by saying, we believe there's no health without mental health, but we also believe there's a trajectory that we really have to not only be healers, but we have to help people thrive. So introducing hope and optimism, that concept of mental well-being in terms of, a sense of purpose and satisfaction with life, work, relationships, the capacity to adapt to life stressors. We think solutions that bridge the full continuum of well-being to healing to remission to recovery, that entire end-to-end. And I think you're right, there is no one solution that is an end-to-end. It's not possible because each of these areas requires dedicated, committed expertise. And so for us, it's combining, it's figuring out, it's that orchestra of effort, and you need the great violinist. Sometimes you need the jazz saxophone. Sometimes you need the drummer. And it's sort of like we all have to make this great music together. And so for me, it's not just the one app or the one solution. It's the integration of complementary, easy to use. So the end user is not burdened. And so our whole digital strategy is, how can we make things easier for people to get help? How can we make it easier to want to get help? And when they finally decide to get help, how can we make sure they get it? And most importantly, how can we measure whether it works? And for us, you can have speed, you can have access, you can have reach, but the quality matters, because the quality means regardless of who you are, where you come from, you're going to get the healing or the prevention or the recovery or the remission that you need. And so that's my recommendation. And I've written 3 books in this area. So I've written 3 books in technology. I was the first developer of the first patient education software in the world. So I've been in this business for 3 decades. And I finally see the dreams we've had for 3 decades, 2 decades, 1 decade. You finally have enough disruptors and innovators figuring out stuff. So this mosaic is finally coming together. So I'm just thrilled to be here at this time to understand the past and to be part of the future.
Thank you so much, Dr. Dewan. Helena?
Well, I mean, always am a little bit wary of giving any kind of advice, but because you asked, I mean, my thought is around it goes back to kind of what I said at the beginning. What is it that has kept vast swaths of the population out of the behavioral health system, looking in from the outside for so long? And while there are obviously needs and requirements to do things like measure outcomes, the system seems highly clinical to people. And so I guess my hope for the future is, how do you deconstruct some of the accepted norms that are over clinicized to make the entry points a little bit more palatable and accessible? Because once people dip their toes in and realize that, this isn't a bunch of experts trying to diagnose you the first time they meet you, and, this isn't a life sentence with a condition that's being attached to you, those are the types of things that are going to break down the barriers. And I think that we do have some work to go as ways to go as a society in working on those issues.
Yeah, I think those are really good recommendations for really, both of you spoke to sort of disrupting the norms and addressing these access points. And Helena, the chat feature, and really, I've never thought about chat as like an equalizer, as you called it. I have lots of family members to also share that with, that I think will help with communication barriers, just with my only family unit. And Nick, what you shared about the orchestra and the mosaic and really thinking collaboratively. And I think that really speaks nicely to the partnership piece and how valuable these partnerships are, as well as the data piece that you mentioned, really the data to inform the direction that we're going. So I really appreciate spending this time with you all, and to all of our audience for taking the time to spend with us this past 45 minutes. And any closing remarks from Dr. Dewan or Helena?
First of all, thank you for allowing me to come to this forum. Thank you for having such a wonderful speaker along, us together. And I think it's not all about clinical. I agree with you 100%. It's about being able to function in life, and it's about being able to thrive in life. And anything we can do to help people do that, we should attempt. And I think we're in a golden era of innovation and disruption in behavioral health. And I'm just thrilled to be part of this ride.
I echo all of that. I mean, like I said, Supportive sees itself as a tiny little piece of the puzzle, and we really look to our partnerships for the true ability to make impact. So, we're very eager to work with systems of all kinds, and improve access and decrease bend that cost curve. So looking forward to a bright future as well.
Thank you both so much for your time. Take care.
Bye.